Hi, how are you doing today?
Good, how are you?
Doing great. I'm Justin. I'm your pharmacist.
Alex Jones.
Alex Jones, great. Go ahead and have a seat for me. All right, Alex, I just have to take care of a couple questions before I get to the counseling. There's a new medication that your doctor's going to start you on today. Do you have a few minutes we can spend?
Definitely.
I can talk about some things about it. Great. I just want to confirm your date of birth, January 6th of '89.
That's correct.
Excellent. And you take Nuvaring currently, the Montelukast and the escitalopram?
That's correct.
Excellent. So this medication that was prescribed to you today by your physician is called doxycycline. What do you know about the medication? What did your doctor tell you about it?
That I'd be taking it for acne. It's an antibiotic.
Okay, that's exactly correct. So it's one of those antibiotics that they use for people that for some reason, you're trying to use those, when you try to use over-the-counter acne medications like Clearasil or Noxzema, and for some reason they just aren't cutting it. Sometimes what they'll do is they'll go to antibiotics such as doxycycline for that reason. The first thing I want to ask you about that is, are you pregnant currently?
I am not.
Not? Okay, great. Excellent. Just wanted to make sure that you weren't. As far as the doxycycline goes, it is an antibiotic. It's a total of 60 tablets. You're going to take one tablet by mouth twice a day. And so you can take that first thing in the morning after breakfast, and then you can take it again right maybe after dinner in the evening. You can separate it by about 8 to 10 hours or so.
Okay.
There's the total of 2 refills on there, so it looks like your doctor might want you to be on this possibly long term, or just to see whenever your acne starts to resolve and get better.
Okay.
So that's the doxycycline. As far as what to expect, did the doctor go over any side effects or anything?
No, not really.
Okay. Well, as far as the common side effects, some people will experience some nausea, some vomiting, possibly diarrhea. That's kind of common with all antibiotics in general. The main thing with doxycycline is it can cause some skin photosensitivity.
Okay.
So what that means is if you're going to be in the sunlight or exposed to sunlight, even if you're in a tanning bed or booth, it can make your skin extra sensitive to it. And so it might make it burn a little bit faster, easier. So if you're going to be exposed to sunlight for extended amounts of time, go ahead and either put on some sunblock or just make sure you're well covered up with that.
Okay.
Do you take antacids like Maalox, Mylanta?
No.
Tums? Nothing? No. Great. So that's good then. As far as any interactions go, I went ahead and did a check. There's nothing. Some people are concerned about combining antibiotics and contraception, such as the Nuvaring. As far as what I can tell from literature and just from the manufacturer itself, is that the only antibiotic that they really concern themselves is if you're taking antibiotics for tuberculosis, which you're not. So with doxycycline, it's one of those things that some people may become pregnant while taking it, because they say if you're taking antibiotics with contraception, it lowers the effectiveness of the contraception, and people get pregnant. And so the chance of that happening here is pretty low, so I wouldn't worry about using any type of backup protection. Have you ever, it shows here that you've been on Nuvaring for several years now.
Yeah, I've been using it for a long time.
Okay, so you're well aware of how it's used and.
Yes.
Okay.
Yes.
Excellent. Did the doctor ever tell you about? Have you ever had any issues with it, like falling out?
Yes, I have. That was kind of one of my complaints to the doctor. So
okay.
Just the falling out is kind of a pain.
Did the doctor tell you how to manage that? What to do if that happens?
Not really.
Okay. Well, it's pretty straightforward. It's pretty easy. So there's a time limit that we're going to look at. So you got to remember the number 3. Okay. So usually when you get Nuvaring, you get 3 at a time, right? So that's an easy way to remember the number 3.
Okay.
So think about 3 hours. If the ring falls out for whatever reason, it's been less than 3 hours, all you got to do is rinse it off with some lukewarm water, and then go ahead and reinsert it.
Okay.
Using your index finger, you pinch it together,
yeah.
Insert it vaginally as far as you can. If it falls out and it's been longer than that 3 hour period of time, you're still going to rinse it off and insert it like you would, but you're going to use a backup contraception, condoms mainly.
Yeah.
You don't want to use a diaphragm because obviously you have the ring in there,
yes.
so you don't want it to disrupt that. But use backup contraception for 7 consecutive days. That way we make sure that all precautions are taken care of and that you won't get pregnant. That's if it's week 1 or week 2. If it's been out for more than 3 hours, go ahead and do that. If you're on your 3rd week of the ring and it falls out and it's been out for more than 3 hours, What you're going to want to go ahead and discard that ring. So place it in that resealable bag, throw it in the trash, and
Okay.
insert a new ring, and start a whole new cycle.
Okay.
And then go ahead and use the backup contraceptive again for 7 days. So it's just based on what week of the cycle you're on,
Okay.
and if it's been out for 3 hours or longer.
Sure.
Okay. As far as the side effects for new ring, I'm sure your physician discussed with you already, but headaches, nausea, vomiting, possible weight gain or possibilities. The main thing with that you want to monitor yourself whenever you take any type of contraceptive is for blood clots.
Okay.
And how people usually know is that they'll have redness or pain in their legs. If you notice that, please call me or your doctor as soon as possible. Let us know. That way we can kind of tell you what to do
Sure.
from that point forward. As far as storing the medication, for doxycycline, it's just a tablet, so you want to store it at room temperature, away from pets or animals, that way they don't get into the medication. And as far as the new ring, also you can store it room temperature as well. You don't have to keep it in the fridge according
Okay.
to the manufacturer. So going back to the doxycycline, how are you going to take the doxycycline?
I'll take one tablet twice a day, every 12 hours. If I have any stomach problems or anything, I can drink water with it and eat food.
Yeah, so you definitely want to drink it with water, of course,
Okay.
and then it's a good idea to have some food in your stomach or a small snack.
Okay.
That way it kind of reduces the risk of you having upset stomach. And like I said, just twice a day, it's easy for people to dose their meds around meals.
Okay.
So if you dose it after breakfast and then again after supper in the evening, that might be easier for you to establish a regimen that way. As far as it goes from here, did you have any questions for me?
No, I've covered it.
Okay, well, if you ever have any questions about anything, just give me a call. My number's on the prescription here,
Okay.
and we'll be happy to help you, okay?
All right. Thank you,
very
sir.
much.
Appreciate
Appreciate
your
it.
time.